My name is Debra Hines-Bruce, and I am a pulmonary hypertension patient. That started out in November of 2015. In 2008, actually, I decided that it was time to take over my life. I was 326 pounds, miserable in a class teaching health, and light bulb went off. How can you teach health and you're not healthy? So at that point, I decided to start dieting and exercising. And that's exactly what I did. I worked hard. I changed my diet. I worked out every day, sometimes twice a day. And I was successful after 2 years. I lost 140 pounds, and I continued to keep it off. And so after that, I kind of plateaued and weight wasn't coming off the way it should. So I decided to join a boot camp. And I did. I joined the boot camp and it was awesome. Life was great. So I normally have a yearly exam with my doctors. I have wonderful doctors. And I just have a yearly exam just to, do a yearly checkup to see how I'm doing. And it was Friday morning, November 20th, 2015. I had taken the morning off to go to my doctor's appointment. Now, prior to my doctor's appointment, I did my normal boot camp, 4:30 a.m. boot camp. For some reason, that boot camp just didn't feel like it did enough. So one of the ladies that was in the camp with me asked if I wanted to go to the gym afterwards. And so we did. We decided to go to the gym after boot camp, and I felt it then. It was good. It was a great boot camp. So after that, I went home, showered, went to the doctor's office for my exam. And he said, "Debra, your lab results are awesome. You are my Shiro." And I laughed because he's been my same doctor for over 20 years. And we have that relationship. So I laughed it off. He was like, "Well, why are you here today?" I was like, "Well, it's for my yearly exam, just to check up and see how everything is going." Then he asked me if I had any complaints. And I told him, "You know what? Not really, but every now and then I notice that I'm short of breath." It's like, okay. And so he puts the oximeter on my finger, and it was at 76. And from what I hear, 92 is the normal. So he said, "Well, since you have a history of asthma, let's do a breathing treatment." We did the breathing treatment, and right after the breathing treatment, he checked my oxygen levels again, and they were at 86. He said, "I'm still not happy. I want you to go upstairs and have a chest x-ray." So I did, came back down, and he didn't tell me what was going on or anything. He looked me directly in the eye and said, "Are you comfortable driving yourself to the emergency room?" I said, "Yeah." He said, "Just get there and tell them I sent you, and they'll be ready for you when you get there." So I got to the emergency room, and they started triaging me and everything. And unfortunately, I had to park far away from the emergency room itself. And at that point, they can really see my shortness of breath. And I really noticed it then. I don't know if it was anxiety along with the exertion, but I was short of breath. And he told me that we have to run several tests on you, so we're going to keep you overnight. I was like, "Okay, cool, I'll be going home tomorrow." Well, long story short, I ended up staying in the hospital in ICU for 10 days. Hospital stay was a total of 13 days. And then they told me that I was diagnosed with pulmonary hypertension. Basically told, and this broke my heart, that, well, you really shouldn't go out and buy a house or a car because the life expectancy is 2 to 3 years. And that broke my heart as well. And when I did research on the internet, there was nothing saying anything different. It pretty much the same information that this is a life expectancy. And I was at Long Beach Memorial. At that time, they didn't have a specialist for the pulmonary hypertension. So they referred me to UCLA with Dr. Shapiro. But this was November. Her first appointment was February. I couldn't get in until February. Now, mind you, I had to go home with oxygen, wear oxygen 24/7. At that time, I was being a little vain. I was 48. I'm too young for this. When I thought of oxygen, I saw older people with oxygen. Like, I'm too young for this. So I pretty much stayed in the house for about a month before I decided to go out. The only thing I did before I saw Dr. Shapiro was go back and forth to my doctor's office. And during that time, before I even saw Dr. Shapiro, I did have 2 other hospital stays, which were scary. And I finally saw Dr. Shapiro in February, and she is a firecracker. And the first thing she said to me was, "I think it's important that you join a support group. There are so many others that you can share your story with and that can relate to what's going on with you." At that time, she wanted me to start 2 new medications, which was Latiris and Adcirca. And so I did. I didn't notice an immediate change, but I did start to feel a little better. And then as time went on, I felt much better. We did a heart catheter 6 months after that. So that was in August. And my numbers were still kind of high. And she said, it looks like we're going to have to start that third medication. And the third medication was the IV Remodulin. And so that's what I'm currently on, those 3 medications. And I feel a big difference. I feel like I can run a marathon. Life is wonderful. I am happy. And just to go back a little, in 2016, I went to my first PH conference. And you know what really amazed me so much was the little kids, to see how they handled it. Oh my gosh. There was one little kid, Jack in particular, that just, my heart just broke when I saw him. And then just to see his spirit, it just made my heart feel so much better. And then just to be around people who knew exactly what I was experiencing. And so one Saturday morning, there was the breakfast where you actually met with the physician, the round table. And so everyone got together and I met this young man. And he was like, I would like to hear more of your story. And I was like, okay. So we switched. I wasn't secure enough to give him my telephone number. So we switched Facebook information. But he did have my room number to the hotel. Yes, I did give him that. He was like, well, do you think I can call you tomorrow? I was like, sure, that's fine. And so he did at 7 a.m. And I was like, okay, I didn't mean that early. Can you call me back in a couple hours? And he did, and we had great conversation. Long story short, that man is now my husband. He's also a PH patient, and we have been going through this together. And it was scary to even think about marrying someone with the same disease. What happens if we both get sick at the same time? And so I decided to let the negative go. Think about the positive. Think about the life that we have together now. Let's just make the best of that. And so that's what we've done. If he's feeling bad, I'm there to take care of him, and vice versa. He's there to take care of me. And that has just been wonderful. And now we co-lead the PH group for Dallas. And that has really been amazing. I love it. I think that's my purpose. I have to say that I have been blessed. The only time I really complain is when 2 things happen. When I totally forget that something is attached to my body and I just walk away, or just want to jump in the shower and then realize that I have to cover my sight, or maybe I pulled it out because I forgot. It's like I have to train myself. You have this new thing connected to you. So you have to be aware of it. So I get frustrated with that part, and when I forget to mix and it's late at night and I don't want to mix. So that's when frustration comes and goes, because of course I'm going to mix. And the other thing is, I don't know why it happens this way, but as long as I am busy doing something, active, moving, I'm fine. But as soon as I lay down for the night, that's when my body starts to ache. And that lasts for the most part for about an hour every night, every single night. I mean, I get over it, but I know it's coming. So that's the hard part. My name is Debra Hines-Bruce, and I am aware that I am rare.